Are these good?
Anti-dandruff shampoos, you know, don't use it if you don't have dandruff in your hair. Because
if I have...
if you don't have it, have dandruff.
Okay.
Because it makes your hair dry, your scalp dry. Okay? And if your scalp dry, you know the sequence for this.
Yes. And what about if I have dandruff?
If you have dandruff, you have to use a well-known one with the least side effect. I will not mention what are the brands in the market, you know.
But we use them, Professor, for a long time, and still we do have dandruff.
We still have dandruff because dandruff is immunity, something related to body immunity, defense mechanism of the body.
So it's not going to be gone by shampoos?
No, it is only clean the
dandruff that we have now.
Yeah.
But not going to prevent it.
No, it is unpreventable. But you regularly clean it, you sweep it, you wash it out. But it will come out because it is there in the physiology of your body. Dandruff always come.
Yes.
But regular washing and cleaning will help to reduce the incidence of the dandruff. So don't use this anti-dandruff shampoo. Some are good, and some are very harmful. So don't go for it. If you want to use good one, but not in a daily basis. Don't use it every day. And
good one, you mean
a good one,
a good brand?
Good brand, yeah. Good.
And of course, not very expensive,
not the cheap ones.
Not cheap ones.
Yeah,
okay.
cheap ones, you know, because why it is cheap? Because it contains some ingredients which are cheap ingredients and harmful.
Okay.
Yeah.
We're having a report, and we'll be back to talk more about how to take good care of your hair and your health in general. Stay tuned.
My name is Fatma Sayed-Qutab. I'm a student at level 9 pharmacy in Riyadh Colleges of Dentistry and Pharmacy.
We would like to know more about your participation in the meeting and how can it serve to achieve the goals of such a conference.
The main goal of the conference, actually the main goal of our college, would be community service and helping, starting researches and helping people solve problems, the health problems that they have. The other one is of our college, the goal of our college would be helping us, the students, to educate us in such a manner so that we are able to deal with the labor market after our graduation. So our participation mainly in this conference was through research papers, and our research papers were printed into posters. This is one of the examples of the posters. This was done by a colleague of mine named Iman Abdul Rahman. It was about smoking. Now, since it is all about community service, smoking has become so common in this world that smoking, we have to teach them, we have to teach the people. So according to this research, they found out that different kinds of replacement therapies for smoking, like smoking people are so addicted to it, they want replacement therapies for it. So the research was based on this one, based on the replacement therapies, and the conclusion was based on if you need a smoking-free world, you need cooperation between healthcare professionals and you need a cooperation between the general population. So our aim was to increase the awareness of the people on the risk factors of smoking, as well as what kind of replacement therapies there were, and for the health professionals who have attended today. Those who do not know the news replacement therapies that have just come out, they can be educated by this particular poster.
We wish you best of luck, and it sounds good, and God be with you, inshallah.
Thank you so much. Thank you.
Welcome back. So up till now, anti-dandruff shampoos are not going to make the dandruff completely disappear from your hair forever. No, it's not. It's just as Professor Farouk mentioned, it's going to sweep it or clean it, and that's it. But don't use it daily. And Dr. Farouk, how frequent shall we wash our hair?
Yeah, maybe once or twice a week, yeah.
Enough. With shampoo?
With shampoo or without shampoo, just some warm water.
No, I'm asking about putting shampoo on it. putting a detergent, sort of a
Yeah.
detergent,
Mm.
once a week is enough?
Once or twice a week.
Once
yeah.
or twice.
But you have to choose a good shampoo. Yeah.
And what about
Non-caustic.
and creams and oils and
Cream don't-
conditioners?
Don't use too much cream on your head because it blocks your hair follicles. It blocks the sweat secretion or sweat glands from functioning because it will keep the sweat under. If it blocks it, it keeps the sweat under the skin, and this will encourage bacterial growth and makes lots
And
of
later on, hair
inflammation.
fall.
Yeah.
Some people, they do, or they are directed to hair transplantation
Yeah.
to solve the problem of hair fall. You told me that it's a surgery, so I want to know to what extent do you recommend it, because there are a lot of aids again that we all the time see the before and after, and we get amazed
Yeah.
with the results. And I see a lot of male figures, actors or so, announcers, and you see the difference of how their hair used to look years ago and now, and it's obvious that they had a sort of hair transplantation.
Yeah.
Yes,
Yeah.
tell me more about this.
Yeah, this hair surgery, it has got lots of side effects actually, and it has to be the last resort for patient.
Yes, yes, doctor.
For patient, he wants to get their hair back, so it has to be the last resort for that. Don't just go straight to hair transplantation,
Yes.
because number one, it is very costly. It needs a well-trained expert to do it, not any dermatologist to do it, But now we find most of dermatologists are doing this hair transplantation,
You
which
mean when they are not
well
highly
trained,
qualified
not
to do
not
this?
specialized in such a surgery.
Yes.
Because for hair transplantation, you take some batches of hair follicle from the back of
put it,
the head, and transplant it in the front.
yes.
So the patient is prone to infection, number one, inflammation, and the cure rate takes time to be cured, and if it is not well prepared and an expert done it, they may fall again. The hair may fall again, you see? Yeah, because the hair has got a life cycle. So this hair which you put, if the hair follicle is not regenerated every time, it will not produce.
So what do you recommend? What do you think could be better, Professor, than the hair transplantation? Medications?
Better
Yes.
thing is to be aware if you have alopecia or your hair start to fall, just try to treat it straight away.
Don't wait until
until most of the hair fall down,
Yes.
or most of the hair follicle dies, because there is no actual treatment for on the scalp if there is no hair follicles. No hair follicles, so no treatment. But if the hair follicles are weak and still there, treatment
could
local
bring
corruption,
a result.
could
There could be
regenerate
good results.
or improve the hair growth.
Yes.
So don't wait. If you do the test, your hair is falling, the combing, first morning combing, lots of hair comes in your hand, in your comb. So you have to seek a treatment. Start looking for what drug you are taking. Avoid these drugs. Because some drugs induce alopecia. If you have too much bleeding or this, what we call it, this bleeding in women, you have to take iron, because bleeding causes iron
supplements.
deficiency.
Yes.
Don't take lots of vitamins. Some people are fond of vitamins. They take it 2 or 3 times a day, which one tablet is enough. So hypervitaminosis, you call it.
It's
or
not good for
hypo.
your health.
Yeah, it's not good.
Generally, and for your hair,
Because, not good for everything in your health. Or hypovitaminosis, you are deficient of zinc, selenium, some elements which are necessary for the copper, iron. you have to take a balanced meal. Avoid taking, too much. If you got hypothyroidism or hyperthyroidism, try to be treated. Avoid drugs, drink water, too much water, so it cleans your body from toxins
yes.
and this stuff. So you have to treat it early.
Yeah.
If not, it will be difficult to be treated. Yeah.
Yes.
And excuse me,
Yes.
there is something else we have to be aware of. Diagnosis. It has to be diagnosed by a specialist person to see if it is hormonal, hereditary, stress, microbial, fungal, toxins, whatever. We have to inflammation, microinflammation. So if we diagnose properly, we can give the right medicine straight instead of treating one cause.
Very good. Actually, I'm enjoying and a lot of new information. We are going to stop with the report and we'll be back. Please stay tuned.
I am pharmacist Khalid Najim, graduated Riyadh College of Dentistry and Pharmacy. I'm working demonstrator in the colleges.
Welcome, doctor, and we would like to know more about the benefits that the visitors will gain from attending such a meeting, and how can you organize to serve such benefits?
Yes. First of all, our focus in this meeting is the pharmacy students, pharmacy interns, physicians. Any health specialty is our focus in this meeting. The benefits, they will get 14 hours of continuous medical education. We have a really rich and comprehensive scientific program discussing and presenting very important pharmaceutical and health topics. Yeah. How we achieve this? Actually, we started work very early. We work as a team for both male and female. We divided ourselves. We have certain committees, registration committee, reception committee. We have the scientific committee also. This is generally about the meeting.
Thank you, doctor, very much, and we wish you best of luck. Thank you.
Welcome back. A lot of new information that we just knew about how to take care of our hair, what types of shampoos shall we use. Don't overwash your hair with shampoos, because in this way it's going to be really dry, and you don't need it to be so dry, so that bacteria and fungi and these things, they do not enter to your hair scalp. I want to ask you, Professor, about cutting your hair. Is it good for the hair health? Cutting the hair frequently, or how frequent? Because we all the time, when you go to visit a beautician, they love to cut your hair, and we don't like our hair to be cut. But they tell us that cutting the hair will make it healthier, and it will grow longer, and it will be more shiny, and it's gonna be better. Is this true or wrong?
Yeah, it is. It can be considered as a true. Yeah. And even people who are not very scientific in this field, even our grandmothers and our parents, they used to cut our hairs, especially for girls. If the hair is not strong enough. You know why? It is like a plant. Hair is like a plant.
Yes.
You find, if you cut the branches from the tree, you allow some other branches to become bigger. This hair, if the hair is too long and the nutrition is not appropriate, so the amount of nutrition to feed this very long hair will not be enough. So the hair follicle will be weaker, and the hair will be weaker, and it may cause alopecia or fall down. So, but if we cut it, so the amount of nutrition may be reduced.
Will be enough for
this small, this strengthens the hair follicle, and allow them to grow better.
My last question, because we don't have time.
Yeah.
When shall we start to cut the hair of our children? Daughters, for example. I mean, young females.
Yeah.
When at
This is
2, 3, or what?
this is traditionally, actually, it is not science, you know. It's better to remove at the first year.
Really?
Yeah, they call it, this is hair of birth. Hair of birth are always weak, you know. So they remove it and allow new hair to grow, which is better.
Professor Farouk Sakr, Professor of Pharmaceutical Technology and Chairman of Pharmacy and Medical Sciences at Riyadh Colleges of Dentistry and Pharmacy. Thanks a lot for being here with me.
Thank you. Welcome.
God willing, our episode is going to be replayed tonight, 11:30 p.m. Makam Kramal time. Tomorrow morning, 9 a.m. Thanks a lot for joining, and see you next time. Peace be upon you.
Thank you. Yeah,
Thanks
it was
a
a
lot,
nice,
Professor.
was a nice.
Thank you.